All right, so our guest speaker tonight is Deborah Salami. She is a qualified social worker with nearly 10 years of experience supporting children and young people and families. She specializes in safeguarding and early help, helping parents and professionals understand what support is available in their local area. Being an African herself, she's seen firsthand how fear and misunderstanding can make it difficult for families to engage with services. Deborah is passionate about breaking down some of those barriers and empowering parents to seek early help well before things reach a breaking point. And we all know what that can be like because we've had some of those discussions on this platform. Her approach is combining professional expertise with empathy and lived experience, creating safe space for open, honest conversations about family support and community connection. So welcome, Deborah, and over to you.
Thank you so much for that wonderful introduction. And good evening, everyone. Thank you for joining us in this evening's workshop. So as said before, this is the workshop on exploring early help. So without further ado, I'll get started. So firstly, just the objectives for this evening. So we'll be exploring what is early help. We'll also be exploring fears and myths about social care and thinking about how and where to find support. So just a little bit about me. There's been quite a lovely introduction to who I am, but just to reiterate for anyone that's joined in the past half a second or minute. So I'm a qualified social worker with expertise within children's social services as well as early help. I also have a background within the charity sector, advancing social care policy for children with special educational needs and disabilities. And I also have my own lived experience, and this makes me committed to wanting to improve access to early help for families. So I really want tonight to be a safe space where you feel free to sort of share your views, your reflections, and there will be points within this session where um, you can do that quite freely. But just a few ground rules before we get into the session. So just to avoid speaking over one another where possible, please feel free to use the raise your hand function or reaction functions. And this is a space within us. This is a space for us. So where possible, it's important for us to definitely maintain confidentiality. So what is shared in this meeting stays in this meeting, if relevant. And again, just to avoid speaking over each other where possible, just remain muted, and also to prevent any background noise. And just for engagement as well, it'll be great to sort of see you when you're speaking. So please do feel free to put your cameras on. I do have the presentation on full screen, so I cannot see anything now apart from the screen, apart from the slides, but there might be a point during the presentation where I remove the slides in order to really be able to engage and interact with you all. So moving on. So I think it would be great to start off with some questions to just see where everyone's at. There's no right or wrong answers, just a few questions that I find quite helpful just for people to begin to share their reflections, share their views. So as I ask these questions, feel free to either raise your hand to share your thoughts, or feel free to use a chat box if you're more comfortable with that. So my first question is, when you hear the term early help, what comes to mind? So I'll give you a few moments to either raise your hand to share your thoughts, or to type in the chat box to let me know for you what comes to mind when you hear that term early help. I think that would be a good place to start. Any thoughts or reflections? No wrong or right answers. It's just simply a space for you to share and for us to have these really important discussions.
I think Janice has got her hand up.
Okay, Janice, do you want to come in there? Apologies, I cannot see anything. So,
It's all right.
yeah,
I'll help
It's
you.
okay. That's okay.
thank you.
I'm not sure if this is correct, but I'm just thinking back because I had an I think I had a meeting which said early help, and I'm guessing it's the stage before somebody gets like an assessment for a diagnosis, just to identify what support you may need in the meantime whilst you're waiting for your assessment.
Yep, that's definitely one of the definitions of early help. Thank you so much for sharing. Okay, now I can see the chat box. So I'll read out the comments. So we have Naya. I know it's not accurate, but mental health is what first came to mind for me. Okay, interesting. And we also have D, getting help before things or situations deteriorate. Yeah, that's a good one. Any other thoughts or reflections? Prevention services. Yep, lovely. Thank you, Naya. Okay, lovely. So, oh, let me make sure I'm not actually leaving the meeting. Okay, so the next question is, what would make it easier for families to ask for help early? So again, just feel free to, again, I can't see anything apart from my slides, so feel free to either just shout out at this point or to write in the chat box, and we'll just sort of hear your thoughts and reflections. Again, there's no right or wrong answer. It's just to sort of see what reflections and what thoughts you have when we think about early help.
Christabel?
I think what would help is for families to know that reaching out for help is not a sign of weakness. And people and you know, families to know that social services is there to help before things get out of hand, like a comment that's been put in the comment section. So when you feel like, you know, you need the support, they shouldn't be scared. But this will only happen if we get the word out there to families to know about the services.
Great. Thank you so much for that, Christabel. That's an amazing reflection. Thank you so much for that. Anyone else?
Someone's put in the chat that to be sure that they won't be judged or blamed.
Yeah.
And somebody else put, knowing social services does not equal prosecution.
Yeah.
Dave's put psychological safety and to know where they can get help. Babs has put help does not mean children will be removed, but the law actually promotes children staying with their families.
Yeah, that's a great reflection. That's really helpful, really, I think, honest reflections, and also really insightful as well around just the fact that help doesn't mean removal, help doesn't mean judgment, it doesn't mean prosecution. So really helpful. And just the last two questions then. Do you sometimes feel unsure about what happens when a referral is made for early help or social services? And then the second one, we'll join them together. Have you ever worried that asking for help might lead to social services getting involved? So you might have asked for support from your child's school or college or nursery, or it could have been through your GP, it might involve your child. Have you ever had a worry about the fact that you're asking for help and this could then lead to social services getting involved? So again, feel free to unmute or to type in the chat box if you're more comfortable with that.
Can I just come in on that?
Yes, of course.
In my experience, and certainly from most of the families or parents that I speak to, they don't actually know what support is available or
Mm-hmm.
that they can access that support. And I think that's the starting point. A lot of people don't actually know that they can seek this support and that it's available for them.
Okay. And that's what we're going to discuss today, get into more detail into that. I guess for those who have, if there is anyone that has felt unsure about if I do ask for help from social care or early help, has there been any sort of particular worries that you've had, just so I can sort of pick this up as we go along?
Yeah, someone's put in the chat, Dave, not comfortable because I have heard horror stories of children being taken away, fear from far.
Yeah. Yeah. And I think that's real. I think we have to be honest about the stigma at times that comes with social services painted by, media, things that are placed online. And again, we're going to have some discussions as we go through. We're going to go through sometimes what are myths and what the actual reality is when it comes to social services. But I appreciate you all contributing and sharing your thoughts and reflection. So we'll just move on, starting with early help, the actual early help system. So early help isn't just one service, it is a whole system with various individuals and services being part of the support when it comes to early help. So it's made up of 3 types of sort of services or systems. And we have first around the family, we can see community support. That's the immediate system around the family. And we can see that friends and family and friends are part of the early help system, which a lot of people may have not thought of themselves as being part of the early help system, but you very much are. And I think at times where we as Africans might be vulnerable, especially with us immigrating from our home countries to another country, is that we may not have our immediate family in the same country as us, or we may have our immediate family spread out in different countries all around the world. So we may lose quite a vital part of the system, which is family and friends. And this can make us more reliant on the other systems that are available within the early help system. And this is why it's really important that we get a better understanding and start having these conversations about what is available, and how we can access it, and sort of dismantling some of the fears and misconceptions that there are about early help. Because in some ways, with us being immigrants, there are some vulnerabilities when we don't have that immediate family and friends connection, or when we're new to the country. So within the sort of community support, we also have online support. So that's where you can sort of go online and find information. We have our voluntary and faith communities for support. We have local businesses, place and environment. So that may be your playgrounds, that may be places that you can sort of take your children and yourselves to do activities within your community. And then outside of that, we have the universal part of the system. So this is where we're thinking about services that pretty much is available for everyone to access when they're at a particular stage. So we have the GP, we have the library, we have the local family hub, we have your earlier settings, so your nurseries, your schools, your primary schools, your secondary schools and colleges, and then also maternity services and specialist public health and community services as well. And then as the system widens up, then we have sort of the acute and more targeted services. So this is when we are now thinking about social care, social services, mental health support. We're even thinking about sort of family support, so really targeted support, whereby perhaps there's a certain goal you want to achieve with your family. If you're struggling with maybe boundaries with your child and wanting sort of tailored support around thinking of strategies around managing that, that's where family support comes in. And then we also have police, we have youth offending and targeted youth services, as well as special educational needs. So This is really just to emphasize when we're thinking about early help, it isn't just your early help team within your local authority. There's a whole system to it, and there's different parts to it. So why is it important to seek early help? There's a number of reasons, but there has been an article by The Guardian which reported on how sort of there's a cultural stigma around certain issues, whether that be neurodivergence and mental health, and this may make families delay seeking help until things become acute, so until things become quite severe. And so The Guardian reported in 2024 that cultural barriers are actually preventing Black children who are autistic or have ADHD from accessing the help when they need it. And this is around the stigma that is present in our communities around special educational needs and disabilities. So that means that our children aren't getting the help that they need when they need it, when it becomes apparent that there are emerging needs for them. And then the Youth Access have also produced a report where they found sort of significant geographical disparities in availability of early mental health support services for young people. And particularly, we know that children from ethnic minority or global majority backgrounds within the UK do not always have enough access to local support, and sometimes have to wait even longer, and sometimes never actually are able to access the support as well. So there's particular vulnerabilities there when we're not accessing mental health support when needed or earlier. And then there's been evidence as well that reveals that parenting support can help to reduce harm to children and strengthen the parenting skills of parents that are facing adversity. So when we're thinking about adversity, we're thinking about parents that may be struggling with their mental health, perhaps. And so parents being able to seek support earlier essentially has a positive impact on their parenting and their children that they're caring for. So when we're thinking about the importance of seeking help, it is really about the impact it's having on children when we don't seek that support earlier. And there's a plethora of research available around the need for support to be accessed sooner before crisis point is reached. So I'm just going to share a video now that goes into early help. It is a US-based video, so and you will hear the term early intervention and early help can sometimes be used interchangeably. And this video mostly focuses on special educational needs and disabilities and accessing that support and what it can do, the importance of it and the difference it can make. So I'll just share that. If there's any issues with my sound, please let me know and we'll try and rectify it.
I was 24 when I had my son. And so I didn't know much about children's health. The doctor told me that he had Down syndrome. And they gave me this horrible list of all of the things that might happen to him. This nurse, she said to me, there are a lot of programs that are out there to help him. And specifically, she named early intervention. When Roderick was born, he came 3 months early, weighing 1 pound and 9 ounces. He's going to have lots and lots of medical challenges, bleeds on the brain. He may have cerebral palsy. He may have vision issues. They sent us to early intervention. So he had a physical therapist. He had an occupational therapist. He had a teacher.
Because of the nature of my birth, early intervention was a necessity. You have this window of from birth to 3. The sooner you get a hold of early intervention, the quicker you'll be able to get the assistance that you need for your child.
Jordan attended school here, right where I was working. He was jumping onto other children. He was bumping into a lot of furniture, and they said to me, "We can try early intervention." My husband, his reaction was, "There's nothing wrong with him. He's a baby." But I said, "You know what? I'm going to do it anyway." His speech therapy was done in school, and so they would see him once in class and once in the clinic. Occupational therapy was done at home. I'm so thankful that the therapist really worked with me and not just worked with him.
There's several barriers that prevent parents from utilizing the early intervention program.
One of them is really about stigma. They believe that my child has a disability and people are going to look at my child differently.
A lack of knowledge, fear, and distrust. A lot of people don't trust the system, but we can let the people know that this system works because we experienced it.
So fathers who are worried about making the step, your child may suffer as a result of your pride. You want to make the best decision possible. And if that means humbling yourself so that your child can get the care that they need, do that.
The early intervention program itself cared about my family. I didn't have to have all the answers. The therapists from the early intervention program were there to help me teach him. The program gave us a sense of normalcy. And so early intervention also gave us hope for the future.
Gets to first grade and they're like, "Why isn't Jordan in the gifted and talented program?" And I looked at them and I'm like, gifted and talented? Even though my son gets services, that doesn't mean he's not smart. That doesn't mean that he can't excel. And sometimes as parents, we think that if a child has a disability, that they're less, and it's not true. They can soar, they can achieve. And I see that with my own son.
Programs of this nature empower families. So don't hesitate. Pick up the phone, call 311, ask about early intervention.
Okay. Oh. Okay. And so this is my own image, because even as a professional, I needed support, and that's okay. Not long ago, I visited my local family hub, parental outreach drop-in. Not as a professional, but as a parent of a very strong-willed toddler navigating bedtime battles and regressions. And despite many years of safeguarding experience and working in early help, I needed someone objective to talk to. And I was met with warmth and really useful tools and a timely reminder of the power of clear boundaries and consistency. And that short conversation with the parental outreach worker made all the difference for me. And although we don't use all of these tools now, months later, what stays in my head is the reminder to be clear with my boundaries and consistent. And that has helped. So we no longer are dealing with bedtime battles and regressions as much as we were before. And so that's my own sort of lived experience of seeking early help support. And I guess at this point, it's a really good idea, I think, to just pause. You've seen the video, you've heard information about the early help system, why it's important to seek support based on sort of the research that's been presented to you, and then sort of my own experience. So it would be great to hear whether your thoughts on what you've heard, if you have any worries or any reflections about accessing early help or social services support, I guess based on what's been shared so far. So feel free to unmute or to share in the chat. Again, I can't see anything, so I'll just wait for any comments to be picked up.
So somebody put a comment just before you started your presentation. I think it's relevant to the question you've just asked. And they've said, not comfortable as I have worked with moms who asked for help and it turned out to be their fault. and it just turns messy.
I think that, thank you so much for sharing that. I think that is a valid reflection. I think it can be really challenging at times. At times with social care, it can feel like it really depends on who your support worker is or who your social worker is. So it can be difficult, and it can make others feel uncomfortable hearing about others' experiences and how things turn messy. I will say to that is that you're hearing from your friends or someone you know's situation, and that's one perspective. There's I think whenever there's a sort of referral into social care or into early help, there's various different perspectives that happens, and that's not always shared in its entirety and cannot always be shared in its entirety with those around the family due to information needing to remain confidential. And not to say that unfairness doesn't happen within the system. I think it happens across the board, whether it's health, whether it's social services, whether it's with the police. There are circumstances where things are flipped, or someone doesn't get the support that they actually need. But I think it's important to be mindful that sometimes not all the information about a family situation will be shared with you. Only certain parts may be shared with you from the friend or the person that you know that has a social worker. So I wouldn't want that to deter you completely, but I completely understand and feel that the feeling of being uncomfortable with it is valid. But just bearing in mind that there would be different perspectives when it comes to support to family and work that's done with a family, and you would only be hearing one perspective, which would potentially be, the parent or the friend of yours. So that's what I would say to that. Any other thoughts or reflections?
We had Babs with her hand up.
Okay, come in.
Yeah, I'm quite happy to go. Thank you. I think what's quite a common theme with families is that sometimes due to negative experiences, people have a lack of trust and confidence in the system. And that could be rooted in quite a number of things in terms of, transparency, actually how that information is disseminated in terms of the social worker or the allocated worker having conversations with that family. And I think in my professional experience, one of the things that seemed to get in the way was how culturally maybe people are parenting could be quite different to this Eurocentric way of doing things. So if I just give like a snapshot of an example of a family that I worked with, it was a family of a very different background. They were Bangladeshi, and he had a 15-year-old daughter and a 6-year-old daughter, and they all used to share the same bed. Now, you can imagine how that went down in terms of social care being involved. But it's those cultural differences where you think, well, if I explain this or if I say this way, then it's interpreted a certain way. But without those conversations where you're having that transparency, that openness to kind of say, look, in this country, this works this way. And I can only imagine people from different kind of nationalities and different cultural backgrounds will have different ways of parenting, different ways of kind of, either rewards or punishing children, and how that would sit when we're in this part of the world. So I think those worries are valid, but maybe a way out of it could be having the healthy conversations, explaining and exploring the alternatives.
Definitely. I definitely agree. And I think one thing I've sort of kept with me, I think in practice is, I think when we have families that are new to the UK, or families that are not aware of sort of laws and legislations when it comes to discipline and parenting within the UK, you know, we can never fully change someone's culture, but we are wanting to change certain behaviors that would negatively be impacting children or a young person. And I think this is why sessions like today are really useful for us to begin having some of these conversations and sort of sharing that awareness of what is allowed in the UK and what isn't. And there has eventually there has to be, I think, that shift, isn't it? That mind shift around certain aspects of parenting that new parents within the UK, or those that are not aware of legislation and law within the UK when it comes to parenting will hopefully develop with support and with cultural understanding, cultural competency, understanding their culture and understanding what's important to them culturally, but also sharing that there are definitely certain behaviors that would not be deemed appropriate, or we would believe would have a negative impact on the child or young person. So it's about trying to sort of change some of those behaviors, but not completely stripping someone of their culture and sort of their cultural values, if that makes sense. So, but yeah, I'm hoping that with the sessions that are happening, workshops like this, that's how we can begin to sort of have these challenging conversations, but well-needed conversations to break down some of those barriers that are present. So thank you for sharing. Was that Babs? Sorry, I can't see.
It's Nya who's got her hand up.
Okay, yeah, okay. Just the person that had come in before.
Oh yes, that was Babs. Yeah.
Okay, lovely. And yeah, did you want to come in?
Yes, thank you. Thanks for the session. It's my first one that I've attended, so do forgive me if I'm talking about things that have been addressed in previous sessions as well. I'm thinking the moment when we are having conversations about what's acceptable within the context of the UK, we also probably need to be having conversations about things that are available. So I'm thinking a child coming from a country where ADHD and autism is not diagnosed as a standard practice, or certain mental health or learning disabilities or difficulties are not discussed within the context of education or something that you can get help for. When they're coming abroad and having those conversations, maybe for the first time, and the same breath also being told that these things are not acceptable, that they're probably already doing at home, I, I don't know how easy it would be for them to then say, I do need help with my child, and yet I know these things are going to come up. I've got a son who's autistic who cannot lie to save their life. And I know whatever you ask them, they will tell you exactly what they will respond and tell you exactly what's going on. And you know certain things as soon as they're mentioned, it doesn't matter how a child mentions them, it is going to raise eyebrows. And I think that's probably one of the reasons why people do not access help. Um, I had mentioned earlier that I didn't think the support that I've gone for required social services. But I did access early help because I did ask for support with behaviors that I just couldn't understand, which turned out to be autism, possibly ADHD. And in the same breath, I felt like I had to fight to get everything or anything that I could get. So, yes, I'm going to ask for help. Yes, I'm going to access services, but you don't meet the threshold. You don't,
Yeah.
my child is not hitting me or threatening to kill me or anything like that. So they don't quite meet the threshold to get the help. So what's the point of asking in the first place?
And
So,
you know what, that is such a, thank you so much for sharing that. And that is such a real and valid reflection and thought. And I think there's two sides to it, because on one side, parents worry about if I share, they're going to remove my child. And then you hear that actually I've shared and I don't meet thresholds. It's not severe enough to meet threshold. And unfortunately, what you shared about having to fight for everything is very much a reality for a lot of parents, especially our parents, Black parents, African parents coming to the UK, having to figure out how the system works, or just in general, even if you're not new to the UK, if you don't have certain access, if you don't have even if it's a time freedom to continuously email or make calls to advocate on behalf of your child, it can be extremely difficult to access the rightful support. So it's and I think we have to acknowledge that we also have a system that is quite underfunded. And although there is movement to the social care system, being reformed, and we'll see some of this happening, next year and the year after when it comes to early help, funding is always a concern, and that makes it very difficult for families to access support. I think from what I can see, where we're at times is, or where we're at now, is really dependent on our sort of voluntary community sector. So these are our charities, these are our, community interest companies, these are our local businesses, and sometimes they're not as publicized, and families are not always as made aware of them. So they're sometimes underutilized and underused, but they are really good sources of information, of support and advocacy. So we're going to get into this within the presentation, but especially when it comes to special educational needs and disabilities, I'm not sure if any of you have heard of sort of the Send IS team, the Special Educational Needs and Information and Advice and Support Service. So that there's a Send IS in each and every single local area. It might be called something else within your local authority. So it might not be called Send IS. They might have another name, but that is specifically around advocating, supporting parents with advocacy, information and advice when it comes to special educational needs. So what services are available, whether it's support to attend meetings at schools, because we know that at times of schools, getting SEN support for your child can be tricky if they don't feel that they're seeing the same thing that you might be seeing at home, if your child might be masking in school. And so that's a service that's out there, but that might not be widely known by parents. And, so that's what we sort of need to be. When it comes to early help, it's not just about relying on or thinking about the local authority early help team, but again, just thinking about those wider community and services and charities that are out there to support and advocate on behalf of families, because of how underfunded the system actually is, and because we are seeing that families are having to battle, or they're not being able to access support as they should, or as a child rightfully should access particular services for their needs. So, but we're gonna get into some of this during the presentation. But thank you so much for sharing that. Just before we move on, is there any other reflections or thoughts or just comments that anyone wanted to make?
Nyas, Nyas put in the chat, local offer, I think, in some areas, and Babs has put well noted, Nya, and that is quite difficult when you do need help, then you face barriers. Please don't give up the fight. You are being resourceful by attending this workshop and doing much more. If I can just add a little bit, I know Yeah, you said it's your first time attending. We do cover a lot of these topics. And one of the things we talk about, and we have talked a lot about additional needs, children with additional needs, and how there is a stigma within the African community. And you are right in saying we need to be having a lot of these conversations. I think if parents are open, I think one of the biggest issues is that parents aren't always open or accepting that their child may have an additional need. And I say it on this platform all the time that I am a mom of an autistic child myself. And this is something that I talk about all the time, about some of the challenges I've had to go through to really seek support for him. And that can be really difficult. And that's why it's so important for us as parents to be equipped with knowledge, because when you know, you're in a better position to advocate for your child and to actually sort of fight, if you like, because that's what it is. You end up having to fight for the support. The support is there, but you have to have enough knowledge in what you're asking for and in advocating for your child. We do have, which I will share later as well. So we will be doing a session on special additional needs, and we do have an educational psychologist who's coming to speak to us on the 15th of December, and that's something that I will share as well.
Lovely. So something that has come up is some of the fears and some of the things that we have heard either from friends or someone who's gone through the social care system and how things were for them, what their experience was, and not to ever take away from anyone's experience because how they felt through the process is valid, and that's how they felt. But I do want us to take the time to discuss some myths that are out there about early help, about social care, and also discuss the realities of it as well. So the first one that comes up, and we've discussed this already, we've sort of touched on this earlier on, but the first one is social services will take my children away. What are your thoughts on this statement here? Feel free to unmute or to type in the chat box.
Someone's put myth in the chat.
Okay. Any other thoughts?
Recently, I felt like that myself, that they would take my daughter away. I felt like that.
Yeah,
Can
thank
you
you for
hear me?
sharing. Yes, I can hear you. Yeah.
So I'll share it's a short story. So there was this other Friday, I got a call from my daughter's school, and they said, they asked them, what does your mom and dad do when you do something wrong or something like that? She's in grade R. And then she says, my mom smacks me. And then I was traveling, and they called me. Then they asked me that your daughter said this and that. You know, I froze because I heard that if your kid says that, they will take the kid away. And then I was going for a retreat, and I asked a lot of people, what should I do? I was so frustrated. And then people were like, oh, it's going to be tricky for you. You have to think of what you're going to say, what. But the next minute, what shocked me is these people did not come back. And on the phone, they said, if you need help, you should tell us. Now I'm afraid. What should I go and tell them? Something like, yeah. So I believe that they were going to take my daughter too. Yeah. I will say it's a reality, not a myth.
Well, thank you for sharing. You know, that's very courageous of you to share. Thank you for sharing your experience, first of all, and, you know, being honest. And, you know, honestly, it is a affair of loads of parents that, so we hear it so often, we see it so often, kiddie snatchers, all the rest of it about social services taking children away. And so when it comes to that, the reality is that the goal of social services is to support families and keep children safe within their home whenever possible. And removal is a last resort. So it's not to say that removing a child doesn't ever happen, but there are steps to it. The situation has to be quite severe for social services to seek for removal. And I think even with that, a social worker has to apply to court in order to remove a child. If a child is removed on the spot, is usually with police powers. So the police are present, or it's that there's been an agreement signed with the parent under what we call Section 20 of the Children's Act 1989, where the parent has essentially consented to the child or young person being accommodated, because there are some concerns about safety, maybe for that time period, that we need to sort of iron out and ensure that there's a secure plan and support in place before thinking about maybe the child returning home, or if that is a possibility. But the reality is, on a whole, especially with the example that was just given, it would be about trying to support you. So if you're struggling with your child's behavior, what support can be offered so that you're using alternative discipline strategies rather than, physical chastisement? Because I think, we have to think about, children's social care is very much focused on, yes, the family, but the needs of the child and the welfare of the child. And there's a lot of research around the impact of physical abuse, physical violence, chastisement on children, and whether that's affecting them behaviorally or whether that affects them emotionally, and how that then affects their long-term outcomes. So that can affect them when they're teenagers, and now they're no longer listening to you. You can't hit them anymore. So then what happens? Now they're sort of really crossing boundaries. So we need to sort of be trying to support parents around developing those strategies whilst the child is, really still young and still able to sort of build those strategies in place to support when that child is old enough and actually can vote with their feet and tell you no, and walk out of the house if that's what they desire. But your voice is strong enough way before they get to that point where they're listening to you and willing to negotiate with you. So I hope that sort of clarifies that. So the next statement is, asking for help means you are weak. And we literally had this in the beginning. So it'll be interesting to sort of see what your thoughts and comments are around this statement here. Feel free to type in the chat or to simply unmute and share. Okay. I will say that asking for help can feel quite vulnerable, and to, many, that vulnerability of asking for help may feel like I'm failing as a parent. I'm supposed to have it all together. This is my child. I'm supposed to know what to do with them. I'm supposed to know everything about this child. And the truth is that we're all still learning as parents. There's going to be curveballs that are thrown into the mix, and we won't know. And so just before I reveal the reality of it, is there anyone that wants to share, or any reflections or thoughts on the statement?
Hi, Deborah. Yeah, I was just going to say, sometimes actually asking for help from a professional stance is seen in quite a positive light. So if you're thinking about maybe a family that's reached out for help, whether it's, with behavioral issues, whether there's something going on at home, even if social care become involved, the fact that that parent actually reached out for help is seen more with a positive slant, rather than you sat there, you knew you were struggling, why didn't you reach out for help? And especially with, a parent maybe who's educated, or, you've got a bit of knowledge, your social worker might ask, actually, you knew this was going on, did you reach out for help? So whilst the stigma, or, there is stigma around, well, if I ask for help, I'll actually look weak. If there's any professionals involved, the benefits are, one, you look like you reached out for help. Secondly, the benefits of actually doing that is, like, let's say you go to your GP or you speak to the teacher or something like that, they would be in a position to maybe support you get that specific help that you need. So it is quite scary, like what you said, and, kind of like the view of, oh, I'll probably look weak, I'll probably look like a bad parent, but actually there are more benefits to it than not.
Yeah, spot on. You took the answer right out of my mouth there. So seeking support shows strength and responsibility. So early help is about prevention, and we've had that in the chat where in the beginning where we were sort of exploring from your points of views what is early help, and someone did say prevention. So it's about prevention and support and not judgment. So actually asking for help is seen as a credit to yourself, to you as a parent. Is seen as you taking responsibility. You're wanting the best for your child, so you're letting go of however you may feel internally that you may be perceived by others, and putting that child's or your children's needs first. So it is a real big sign of strength, and reflects really positively on you as a parent when it comes to social services, social care, and family support teams.
Deborah,
Okay.
can I come in for 1
Yeah.
minute? I wanted to just touch on what Barbara's just talked about from a professional perspective as well. Well, not from a professional, but from a cultural perspective. I think for us as African parents, I don't think it's so much about being weak, but it's more around culture, and being judged and being seen as not being, I think for us African parents, and I think I talk about this a lot, there's a thing about us coming across as perfect parents almost, and almost feeling offended when someone suggests, for example, that your child may be struggling with this, or that they've noticed something, and people tend to suffer in silence. I don't think it's necessarily about being weak, but it's about not wanting to be seen as not having a perfect child, or also being judged by others. So there is a mix of that. And I know we, on this group, we do a lot of discussions around how culture impacts or influences how we even accept advice and guidance. Because a lot of the times, I have put in the chat when we were talking about, the aspect that social services will take your child away. Yes, in situations that are very necessary, but we're talking about those instances where people are misinformed about the reasons. I think it's fair, going back to, I can't remember who it was that said they worked with mothers who would had their children, or who'd been punished for seeking support. I think it's important to recognize that someone's never going to tell you the honest truth about the situation. And I think we have to really be honest about that. For a court to sanction the removal of a child, there needs to be evidence, factual evidence. And we've talked about this a lot of the times, that just the mere removal of a child from their parents infringes someone's human rights. And the court has to have evidence that that is necessary, to breach somebody's right to family life. So we always have to be mindful when people are sharing their stories with us. They're not always going to tell us all of the information, and social services cannot publish all of that information because of confidentiality, like Deborah said already. So there is quite a lot of complexities when it comes to social services. But I think knowledge is power, and if parents are equipped, then you're going to be more open to learning and avoiding those things happening to yourselves.
Yeah, and I think just to thank you for that, and I think just to come in there, it reminds me of a situation that I had where a while ago, some years ago, where I was in a child protection conference as a social worker for a family we had concerns about, and the mother of the children invited her friend to the conference as her support. And in child protection conferences, you have professionals from different agencies. So you have police there, you have education there, you have social services there, you have health there. And everyone is sharing information about, the family situation. We're also, hearing from mum about how she feels. And the child protection chair had asked the friend of mum about her views about the situation, and the friend said she was shocked. She didn't know any of this information, that yes, mum had told her some things, but hearing everything here, she agrees with the children being placed on child protection. She didn't know how bad things were. And I think that's just to hone in on the point that you may hear of somebody's, and not to say that there are not negative experiences that people have with social services, those experiences are fair and valid if people have had them, but when you hear a friend or someone talk about their experience with social services, you are literally just hearing one perspective. And as I said earlier, there's sort of different perspectives, and it's only unless that parent has invited you to meetings or has shown you the documents and records, or you've been involved in a very sort of deep way, that all the information that is that social care are worried about or there's concerns about will you be aware of. So it's about being mindful about what is out there. People, in order to not feel judged by other people, they may share certain things about their experience with social services, but you may not be getting the entire truth. And I think, someone else has said in this call that they did ask for early help, or they asked for help, and then they were told that their situation wasn't severe enough or doesn't meet criteria. So we have this dichotomy here where people are asking for support, and they don't care. They're asking for support, which is great, and regardless, I want to have the support. And then they're finding out that actually your situation is not as bad, or is not as severe enough to meet the criteria, to meet the threshold. And then we have someone else that has a situation that is meeting a threshold for whether it's child protection services or child in need services. So it's just about really being mindful and taking each person's situation and not just judging straight away. And that takes me to sort of the last statement: I will be judged. And we've spoken a lot about judgment. And I think, as rightfully said, within our cultures, within our communities, there is a sense of wanting to look perfect, wanting to look like you have the perfect family, the perfect life, the perfect children. And there is a worry at times that if I share that I'm struggling, or that there are struggles, I will be judged as a parent. I will be judged as failing in my role as a parent. I will be judged as not being good enough. And there might be even more to that, but it would be great to hear people's thoughts on this last statement here. I will be judged if I ask for support or access, even if it's social care support. Any thoughts or reflections on that? Feel free to unmute or to type in the chat box or to raise your hand. Mm-hmm.
I have got some comments in the chat. I'll read out. So Frank's put, in my case, the council got involved, got the children's services involved when my wife and I refused temporary accommodation. I'm sure it was to make us scared to change our minds. I told the children's services that they can come and get the kids if they want. They replied that it won't be the case.
Yeah. So with that, I guess with temporary accommodation, if housing, usually what happens is that if a family if there's worries about homelessness, is depending on the situation, it's usually housing that will have the duty to sort of rehouse the family, and housing will offer temporary accommodation. It's not always in the best of conditions, and it's not always what.
No, I think they mean Section 20 accommodation for their child.
Oh, okay.
Yeah,
So this was okay.
yeah.
Okay.
I think this was Section 20. I think the local authority wanted to, is that right, Frank? Do you mean that they wanted to accommodate the children or offer you from my reading, it looks like he's talking about Section 20. I'll let you comment back, Frank.
Okay.
On that. And then I've got Ephraim just put, I think instead of factual evidence, we use balance of probability. If a child says it didn't happen, they can narrate it, and they can narrate it clearly. Then on the balance of probability, it might be acceptable that the incident happened. Yeah, I responded to that to say, yes, and at times the child's voice also is usually backed by evidence as well from other professionals, from, for example, from school, health, and the police as well. Usually where you have these issues where a child does end up being removed, there will be another agency that has concerning information to share as well. And then Babs put, the threshold for removing children is so high, and the law supports children being placed at home before removal. The law places the duty of the local authority on supporting children to remain with their families. And then she's just put that she completely agrees with Chennai. Well captured, Deborah.
Okay, lovely.
Oh yeah, so Ephraim's come back, sorry. No, Frank's come back. It was accommodation for all the family from council housing. All right, I see.
Yeah. So where you've refused temporary accommodation, then housing see as you're deemed as intentionally homeless. So then the duty then falls potentially on social care to do an assessment in order to prevent homelessness. So that's probably why you got the call from social care. But if you were able to arrange yourselves as a family, then, social services will, okay, fine. As long as there's, this is what you're saying, there's evidence that you're not going to be homeless, or you've been able to go back to housing and they've been able to offer you maybe something more suitable that you wanted, then that's fine. So social services, I know there's a lot that's said about social services, but honestly, if there's not a need to be involved and there isn't grounds to be involved, the system as a whole is so under-resourced and overstretched. We wouldn't just be getting involved just for the sake of it. So I think that's where you've told them to come and accommodate the children, and clearly they have not, because I'd like to think that there was a sort of discussion with yourself around how you would manage and sort of figure out accommodation for yourself as a family. So again, back to the last statement, I will be judged. So workers are trained to assess situations and focus on solutions. So their goal is to understand what's happening and offer the right support. Now, I know there's been conversations on everyone, like people's different experiences with social care and early help, but as a standard, it is about seeking solutions, seeking support for the family. It's not about judging. Judgments do have to be made around family circumstances and situations. So when we're thinking about when I say judgments, where there's an analysis happening of what are the strengths happening with the family, what are the areas that social services or early help is worried about, and where does that family then sit in terms of their level of support. So a judgment is made on that based on information that is shared with us, based on conversations that we have. So it's really about reframing that. So where people may feel that they are judged, in fact, it's not you being judged as a parent. There are judgments made on your family's circumstances in terms of how you will be supported and what service or what type of support will be best suited to your family. So we have spoken quite a lot about transparency when it comes to social care, and not fully understanding how it works. And I want to do a bit of almost like demystifying and sort of breaking things down in terms of how the system generally works, from sort of the beginning to when a parent may get a phone call from a social worker. So there is a threshold document that each and every single local area, local authority has on the different thresholds and levels of support when it comes to worries or concerns that they have about a family. And this can be found on the local children's safeguarding board's website, usually of the local authority, or a local children's safeguarding partnership websites, where this threshold document is published. It's usually used by professionals, but honestly, anyone can access it if you are actually looking for it. And so what then happens is a professional, so that could be a teacher from your school, so the designated safeguarding lead. This could be a health professional, it could be a health visitor, it could be a midwife, it could be a GP, it could be a sort of family hub support worker that uses this threshold document to get an understanding of what level of support that a family can access from, whether it's early help within the local authority or social services. And then they should be having a conversation with you as parents in order to seek your consent for referral to be made into social services. So that's for when we're talking about social services, that's also including the early help team within the local authority or the social work team, children's social work team within the local authority. So once they've sought your consent, they've had this conversation with you, they'll either go through the CAF, which is a common assessment framework, or the referral form with you. So going step by step around what they're putting in the referral, whether it's the strengths, the worries, what has come up for them to want to make the referral. And then this referral goes to the MASH team of the local authority. So that stands for the Multi-Agency Safeguarding Hub, or the front door, and this front door team of social services. And this is where the screening happens of the referral. And if applicable, this referral is then sent to a social worker within the MASH team or the front door team, who will then give you as a parent a call to share the information that has been received. So this is generally the process when it comes to referral. But I think it's important to, acknowledge at times that where there are certain concerns that you may not always, parental consent may not always be sought. You might just receive the call from the social worker. But as a standard, generally professionals need to be seeking parental consent. But where that has not been sought, then social care should usually be telling you at some point why it wasn't sought. But as a standard, depending on the level of concern, your consent for a referral into social care should be sought, and there should hopefully be a transparent and open conversation. Now, at times what I have seen is that families are hearing about concerns and worries for the first time. So whether it's a teacher or health worker that's involved, hadn't really shared what they're worried about with the family. They thought, oh, well, well, social services is getting involved to help with a completely different issue. And within the referral, there's information that they were not aware was going to be shared, or information that they did not know was going to come up as a concern. And, at times as a parent, you may want to see that document. You may want to see that referral. You may want to know what exactly has been written about my family, and what exactly has been written about my child. And this is where I think I'm trying to break down some of break down things when it comes to transparency. So where you are wanting to know and wanting to know what information is held about you, you can make a subject access request, and this is governed by GDPR and data protection. And this means that whether it's from the local authority, or whether it's from education, so whether it's from the school that made this referral, or from health that made this referral, you can request case notes from whether it's from social care, from early help, or education, as I said. You can request copies of assessments, meeting notes, emails, and reports that include you and your child's personal information, as well as details of who has seen sort of your data and who it's been shared with. But what you can't ask for is information about someone else, about other people, and also about professionals, sort of private notes that don't form part of the sort of official record. So what happens is once you make this request, the local authority has 1 month to respond once receiving your request. And usually there's an email or there's some contact on the local authority website. If you type in subject access request, that gives you information about how you can go about making this request. And they may ask for perhaps your ID or further clarification, just to sort of verify who you are. And just to also note, in some cases, depending on how sort of complex your request is, the time frame can be extended to 2 months, but the local authority or the organization must tell you why. So I think I really wanted to highlight that, just because a lot of the time information is shared about families, about parents, and it can all feel very behind the screen. You're not aware of what's being shared, and there's different things coming out at different times. And this is just a way of you being able to access and having sort of better clarity and transparency about what is actually being shared and what the concerns are. Okay, now thinking about the different types of support usually available within a local area. So we're thinking about sort of parenting support, mentoring support, whether that's for parents or for young people and children. We're thinking about emotional mental health support as sort of staple services that are available within a local area. When we're thinking about our families that are new to the UK, maybe on whether it's a skilled workers visa, we're thinking about no recourse to public fund services. So there is sort of nationwide support. I think migrants help, but at times there are also local support services available, and sometimes support services within the local authority, support teams within the local authorities that support families that have no recourse to public funds. And then also drug and alcohol misuse support. So you may have a teenager that is using cannabis experimentally, or using other drugs with their peers or friends, perhaps on an experimental basis, but it may also be a cause for concern. So it's important to know that there are sort of drug and alcohol services available within your local area that supports young people around managing their use of whether it's drugs or alcohol. And then a big one that we've discussed is special educational needs and disability support within the local area. So this isn't this list here isn't an exhaustive list, and is definitely not limited to these types of supports that I've mentioned, but it's just to show you that within your local area, there's sort of a varied and wide potential different types of support services that are available. So I just want to share a video about the Family Hub. So within local areas, it could be known as your Family Hub, or it might be known as still known as a children's centre. But I'll share this video and let me know if there's any issues with sound.
Well, from it, we've got a massive group of friends, 11 mums that I've met through coming here, and we all see each other at least 2 or 3 times a week. You don't feel rushed. There's no pressure. It's really relaxed, and it just brings people together.
You know, I'm here with my daughter. The main reason why I come here is for her to interact with other kids.
So we've met a lot of people here who we're now all going on to the same nurseries and potentially the same schools. So you're starting to build connections with people, bounce off each other, ask each other questions about your baby and the development, and also just learn about what else is happening in the community.
I think it is really important, just interacting with other parents and other children, because if I'm with my first, I stayed in quite a bit. So to be able to get out and learn something that I can then take home and do with her and bond with her, it's nice.
Well, it's meeting with the parents, and also for my son to make friends and to mix with other peers. Whether you've got deaf or hearing children, they all mix together. I'm able to get more information, having conversations. It might be somebody else is going through similar things to me, so you learn from each other.
Having this support has made me been able to think I'm not by myself. There is help out there. You need it. It boosts my confidence and help with a bit of my mental health state. So it's helped a lot.
Yeah, it's really good. My daughter, she really enjoys coming. She learns, she's signing, she's seen signing, and she's really keen to come. I think it's great for her to be here.
Obviously, as a first-time parent, I get to share my experiences with other fathers, and I get to hear their stories, and hopefully I can help other people and they can help me. I've got confidence in being a better parent and knowing how to handle different situations. Once I've been to the first session, then I was determined to come back again and again because I got a lot out of it.
I did find breastfeeding in the beginning very difficult. I was determined not to give up, but I needed help, and this group just helped me achieve that.
The group's been incredibly important to me in terms of just like my own anxieties. The people behind like working on it is, you know, they've been incredibly helpful with answering my million questions that I've had.
It's been nice as a way to practice feeding in public, have that safe space where you can feed in public, but the security of sitting with a group of mums all doing the same thing.
I would have had no idea without this group, and it's been incredibly important in getting her to where she is now. I don't think it would have happened without this group. So really, really important.
I don't have a lot of family here. This group, play group, like family for me. It's very important for everyone to come. Your mood also is changed. Also your language you can improve. Now I told everyone when I go outside, come.
Okay. So now where to look for support? So someone has rightfully mentioned, I think earlier on in the chat, your local offer. So each and every single local area, local authority will have a local offer website where they list the different array of services available. So there's usually a specialized local offer for special educational needs and disabilities. So where you are looking for specific information about support services available for a child or young person with special educational needs or disability, there is a specialized local offer for that. There's also a specialized local offer for kinship carers. I think that's something that's still emerging. So it should be there, but I think some local authorities are still sort of getting that set up. So when we're talking about kinship care, we're talking about friends, families, very close members, very close members of families that are taking on care and responsibilities for children within their network. So you could be a step parent, you could be an auntie, you could be an uncle, you could be a grandparent, you could be an extended family member or someone within the child or family's close community that's taking on sort of care and responsibility. Perhaps if parents aren't able to do so, there is and there should be, and if not on the way, there should be a kinship local offer aspect of the local offer website available. And then where we also have care leavers as well, there should be a local offer section part within the overall local offer website for your local authority. Some areas are better than others when it comes to these things, but those are sort of very free, important services around sort of special educational needs, local offer, kinship care, and care leavers, local offer. And then we've just heard about the family hub from the previous slide in the video. So your family hub, children's centre, depending on the age of your child, could be a very good source of information and support. Family hubs usually support children from 0 to 19, and if the child or young person has special educational needs, they have information for support from 0 to 25. So familiarise yourselves with your children's centres, your family hubs. And then we've spoken about within the presentation, your threshold document, so your local authority threshold document. And this can be found on the local Safeguarding Children Partnership website of your local authority. So each local authority or local area has one. You know, have a look. You can download it, you can print it off, you can, really familiarize yourself with how the sort of different support services and the different thresholds work, so that even for you as a parent, when you are wanting to access whether it's early help or social care support for your child, you're able to quote back on the phone to the social worker, well, no, my child has this need, or we have this need in my family. It says in the threshold document that we actually meet criteria for tier 3 support or tier 4 support, which is statutory social care services. And then you could also contact your multi-agency safeguarding hub team or your front door team. So that's the front door of social care, to ask to speak to a social worker or social work assistant to inquire and understand what is available in terms of support within the local area. And then there are groups such as this, where we're thinking about sort of our parent carer forums or groups, social media, as well as search engines can be helpful, as well as going to sort of professionals, whether that's your GP, your health visitor, going to teachers, your support workers within schools, and when we're thinking about support. So that is sort of the workshop for today. These are my details in case anyone wanted to connect with me. I thank you so much all for your contributions and your reflections. You've made it a really sort of honest and safe space, I think, where people have been able to feel safe enough to share their own personal experiences and their worries. So thank you all so much for a great session and for your amazing contributions. So I will stop here.
Oh, thank you so much, Deborah. That was so insightful, information packed. Thank you so much. I'm sure everybody, as I have, has learned a lot. Perhaps we need to invite you to come back and do part 2. because we do have other areas of early help that we did want to explore, particularly what support is available for people with no recourse to public funds, for example. So maybe that's something that you can discuss outside of this and see whether there is more information available around that. That we could share with people. I think one of the other things that I just wanted to highlight as well, or just to add on, is the fact that people can request advocacy support as well. As Deborah already said, there are a lot of non-profit organizations, charities that support families, migrant families. And if you feel you are receiving a service that you don't quite understand, there will be people that are there to explain things in a way that you understand. It is far much better to understand things than to just go with it without knowing, or to refuse certain things without knowing the consequences for it. Because sometimes as well, there can be consequences for not accepting support as well. But thank you so much, Deborah, for this really, really helpful session. I have put a feedback form in the chat. If you could all fill that in for us and give us some feedback. Particularly, Deborah would like some feedback on how the session is gone and how you found that helpful, and obviously so that she knows how to design it for future parents that may other groups that may want similar information. What information was very useful for you, and what areas what other information do you need for the future? As I said, maybe we could have a conversation about a part 2 if people feel that they need more information. It is a lot of information, isn't it? So it's a lot to fit in sort of like in an hour. So perhaps maybe a part 2 might be helpful. But thank you all so much. Thank you so much, Deborah, for sparing your time on a Monday night. Really, truly appreciated, and thank you all for joining. I don't know if anyone's got any questions for Deborah before we come to a close. Anyone with a burning question or comment? Feel free to just unmute and speak. I will stop the recording.